Hi everyone, Namaskar. A very good day. Hope all of you are doing well. All are in a good health and good mind. Myself, Dr. Jogendra Kumar Bastia, neurologist, SKS Neuro Super Speciality Hospital, Hyderabad. Dear friends, today I am very much privileged to share with you an unique information. Today I am going to discuss with you about a modern therapy, a new technology that is going to bring a radical change in treatment of different neuropsychiatric diseases of brain, nerve and mind. We are living in a modern era. This is an era of internet, supercomputers, artificial intelligence, robotics and automation. This world is moving very fast. Things are getting done very easily, very effectively in a simple way. People can get answer to their questions just by click on their computer in fraction of seconds. They can communicate with each other. They can send money in milliseconds, those living thousands of kilometers away from each other. One can travel from one end to other end of the world in few hours. All these are possible because of very high quality, high-tech technologies that are developing time to time. Then why should our healthcare system fall behind? That's why new age technologies coming time to time reshaping our modern healthcare system. Nowadays, people don't want anything painful, anything harmful with side effects, anything with complex processes or complicated procedures to get rid out of their diseases. They just want something very simple, very painless, but very effective. They want something without any side effects, without any harm, without any complicated procedures or processes to get relief from their health problems. Keeping these aspirations and expectations of the people, these new age technologies, these new modern therapies bringing new hope and new solution. Today, I am going to discuss about such a new modern age technology that is going to treat people of nerve, brain and neuro disorders. The new age technology is RTMS therapy, repetitive transcranial magnetic stimulation therapy. It is a modern day cutting edge neuromodulation technique, a non-invasive brain stimulation technique used to treat many types of psychiatric and neurological disorders, diseases of brain, mind, nerve and muscle without any harm, without any serious side effects. It is painless procedure. It is very simple to administer. No need of any surgery, any anesthesia. No need to do any needle prick or any injections. This therapy does not need to eat any medicines or liquids. It treats you, heals your disease, just simply delivering magnetic pulses to a specific part of your brain, and that was done simply keeping a magnet on a specific target area of your head from where the magnetic pulses are delivered into your brain. Now let us know about the RTMS equipment, the RTMS machine. The major part of the machine is the magnet. It is called RTMS coil. It is of different shapes. The commonly used one is figure of 8. It looks like the English number 8. Another one is circular coil. It is a rounded coil. This coil, this RTMS coil is connected to a generator which creates magnetic pulses which are delivered through this coil into your brain. To start therapy, this coil is kept over your head on a specific part. This specific area of the head can be different for different diseases. In some diseases, it is kept over front of the head. In some, it is back of the head, either in the center, on the side of the head. That all depends upon which type of disease we are going to treat. When the treatment starts, this RTMS magnet starts delivering magnetic pulses into your brain repeatedly again and again, which you can feel just like a light touch on your scalp with a tick-tick sound. These pulses can come at a faster rate or it can be delivered at a slower rate. At which rate these pulses should be delivered is decided prior to the therapy because it is different for different diseases and it can change from person to person according to their need. When you deliver the magnetic pulses at a faster rate, at a speed, it will cause activation of your brain which is already inactive, which is already lazy, sleepy, sluggish and brings it back to its normal state. On the other hand, when you deliver the pulses at a slower rate, at a slow speed, it will suppress the brain. It will inhibit the overactive, overstimulated, oversensitive brain and brings it back to the normal state. Also, some other parameters decided prior to the therapy, like at what force this pulses should be delivered, the intensity, how many pulses should be delivered during each therapy, each session, at what interval, and for which duration. All these things are fixed before starting the therapy, that is called RTMS protocol. These two things, the target area, which part of the brain to be stimulated, and the RTMS protocol, what type of pulses, at what rate, at what force, for what duration, all this very specific for different diseases, and also it can vary from person to person. Deciding a specific target area, a precise target area for each disease and each patient, and also deciding a specific RTMS protocol is very crucial and very essential to get maximum benefit from this therapy. And also, you have to take this therapy for at least some days or sometimes some weeks to get the maximum benefit. Sometimes some patients tell they are not getting any benefit from this therapy just after taking 1 or 2 sessions. This therapy does not work like that. At least you have to take this therapy for multiple sessions for at least some days, or even in some diseases for weeks, to get the maximum benefit. Now we will understand how the RTMS therapy works to cure, to treat our nerve and brain diseases. It works by modulating, modifying, correcting, rectifying the function and the structure of the part of the brain which has become abnormal due to a neurological or psychiatric disease. It does not affect the normal part of the brain, so does not produce any abnormal undesired side effects, only corrects the abnormal part of the brain. To understand the exact mechanism of action of RTMS therapy, we should first know how a normal brain functions. Human brain is one of the most mysterious creation of the nature. In spite of so many technical advancements, scientists still don't know how a normal brain exactly functions. Still, I will try to explain you in a very simple way. Now just imagine a very big power station supplying a very large city of millions of people living in thousands of households, hundreds of heavy industrial complexes where thousands of heavy machineries are running continuously. Whether it is a small light bulb in your house or it is a heavy machinery in an industrial complex, all of them run so delicately, so well balanced. That is only because of that super efficient power station that is continuously supplying them electricity in an accurate amount as much as they need. This is possible because of a very efficient, robust network of connections present inside that power station, because of that robust wiring where there is continuous flow of electricity that controls the supply of electricity to each and every small to big electrical equipment in the households or in the industry. Any disruption in any part of the power station, that will be reflected in the corresponding part of the city where the electricity supply will be disrupted, life in that part of the city will be disrupted. Now further imagine, there are hundreds of such power stations installed inside your head and they are running continuously, uninterruptedly, day and night, without any rest, without any break, throughout whole of your life, and controlling each and every function and reaction of your body, whether it is a minor, major, whether it is a biochemical, electrical, whether it is a physical, physiological, mental, psychological, or any other function of the body. Human brain controls, maintains the function of each and every part of the body through a super efficient, robust, complex network of connections between billions of neurons present inside the human brain. These neurons, nerve cells, interconnected with each other through numerous electrical and biochemical circuits known as neuronal circuits or brain circuits. Through these complex network of brain circuits or neuronal circuits, these nerve cells continuously communicates with each other through electrical impulses and chemical signals uninterruptedly, continuously throughout day and night, and controls, regulates function of each part of the body. Whole of the brain, along with its underlying circuits, are divided into many parts and regions. Each of this brain part and region is responsible to carry out and control a specific body functions. For example, the anterior, the front part of the brain is responsible for our mood, thought, decision making, executive function. The side part is responsible for hearing, listening, and for understanding the speech and language. The back part is responsible for eye vision and seeing, The central part is responsible for movement of the body parts for walking, running, dancing and other body activities. If any one or more such parts or regions of the brain is affected, damaged, its function is disrupted because of many diseases like brain stroke, tumor, trauma, infection or neurological, psychological, psychiatric disorders, the corresponding body function will be affected, will be disrupted. Here comes the role of RTMS therapy. In RTMS therapy, it will deliver focused magnetic pulses to the specific affected target brain area. These magnetic pulses will be delivered repeatedly again and again. It will create a local field of electricity in the adjacent brain cortex, which will further cause firing of the neurons, and the neurons will be excited. It will send more and more chemical and electrical signals to the brain circuit and will cause release of more brain chemicals, neurotransmitters in the affected brain region, which will be responsible for short-term immediate effect of the RTMS therapy. Sometimes when you deliver the magnetic pulses at a slower rate, in a low frequency, it will suppress, deactivate the overactivated, overstimulated neurons, suppress them, stop them sending excessive abnormal signals, electrical and biochemical signals to the brain circuit that will be responsible for bringing back the abnormal, excessive, overstimulated brain to its normal physiological activation stage. When multiple sessions of RTMS therapy is delivered over days, weeks, even months, it will produce some essential, some necessary structural changes in the affected brain area in the adjacent brain circuits. This will cause formation of new circuits, new brain connections, new neuronal bridges and neuronal connections, which is necessary, which will strengthen the affected brain activity. Also, it will destroy, it will reduce the unnecessary brain connections, unnecessary brain networks, unnecessary brain neuronal bridges, and this reorganization of the brain structure in the affected brain area will restore the disrupted brain function and bring it back to its normal physiological stage. This is called neuroplasticity. Because of this neuroplasticity effect, it will produce a long-term beneficial effect even after you stop giving RTMS therapy. This effect will continue for months or years. Now we understood what is RTMS therapy, how does it work, what is the mechanism of action. Now we will understand who are the patients eligible to take this therapy. Any patient who has a disease in which RTMS therapy works can take this therapy. Those having indications of RTMS therapy can take this therapy, whether you are a young boy, whether a very elderly man, whether you are a pregnant lady, lactating or nursing woman, whether you are a patient of heart failure, renal failure, kidney failure, liver failure, lungs failure, whether you are taking multiple medicines, any type of patient can take this therapy, are eligible to take this therapy if there is an indication for it. However, there is some specific contraindication. There are few patients who cannot take this therapy. Those having a metal in their head or body, especially if it is a ferromagnetic metal, if there is an aneurysm clip, a surgical clip in their head, those having a cochlear or eye implant, those having a pacemaker, a defibrillator implanted in their heart, those having an infusion pump, these machines may get damaged because of magnetic pulses. So these are few conditions in which those patients are contraindicated to take this therapy. Now comes what is the side effects, what are the adverse effects from this therapy. This therapy has no side effects, no serious, no major adverse effects. I am not bluffing, I am telling the scientific evidence which is from hundreds and thousands of clinical trials done over last 40-50 years. This therapy has been given to millions of people throughout the world for different neurological and psychiatric diseases, and none of them got any serious, any major side effects. Yes, there may be some minor side effects like little pain or discomfort over your head just while taking the therapy, sometimes little tingling sensations, sometimes some ticking or ringing sound in your ear, sometimes little hearing loss, but that is very temporary, very minor. You will get it while taking the therapy. It will last for a few minutes, sometimes few hours, and it will go away automatically. No need of any special attention or specific treatment for the side effects. So you can definitely take this therapy if there is an indication. You should not be worried about the side effects. In this video, we learned what is RTMS therapy, how this new age modern technology treats, works scientifically to heal, cure the brain diseases, mind and nerve diseases painlessly, simply, effectively, without any side effects. In the next video, we will learn all those conditions where RTMS therapy is helpful, and we will know how it is replacing the traditional medicines and becoming a sensation in the field of neuroscience. So wait for the next video. A humble request, like the video, subscribe the channel and press the bell icon so that when any new information comes, you can get it. Thanks a lot for this patient hearing. Jai Hind.